Coming up on American Medicine Today, the latest research in nutrition suggests a direct connection between the food you eat and the mood you are in. Mary Beth Albright joins us to discuss the science in her latest book, Eat and Flourish. Then Danny started experiencing lower back pain while lifting heavy objects at work. After reaching a breaking point, he finally sought help from the Bonati Spine Institute and is now happy to get back to work pain-free. Finally, Dr. Bonati defines when people should seek treatment for chronic back pain, learn which conditions can be treated with physical therapy, and which will require surgery. Coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker and world-renowned orthopedic surgeon, Dr. Alfred Bonati. So a groundbreaking new book draws on cutting-edge research to explain something called the food-mood connection. Joining us to discuss is Mary Beth Albright, food expert and author of Eat and Flourish, How Food Supports Emotional Well-Being. Thank you for joining us.
Thrilled to be here. It's such important science, and thank you for giving the time to talk about it.
But I have to point out something. You apparently competed on Iron Chef America. I love that show. Real quick, how did you do? Did you win? Who did you compete against?
There's like a 1 second answer and there's a 30-minute answer. So I'll give you the 1 second answer, which is yes. It was a nutty time. It was about 10 years ago. I was on a weeks-long competition with Food Network, and it's all experience, right?
Sure.
Like it all comes in, it all feeds into the food experience. So I'm happy to talk about that at a different time.
Absolutely.
Certainly. Well, let's get right into it. Why don't you tell us about the food-mood connection?
Yeah, well, about 15 years ago, I was at the Surgeon General's office, the U.S. Surgeon General's office, and a journal article passed my desk that was about how omega-3 fatty acids could reduce aggression in men. And it was the first time that I'd ever seen something that was peer-reviewed, that was in a journal, that had hard science attached to it, that was like, look, there is a food-mood connection. And what you eat affects how you feel and how you act, and how you feel affects what foods you choose. It's this connection that we can either get to know it and make friends with it and learn about it and learn about our bodies, or we can just say like, oh, I'm just never going to emotionally eat ever again. And the truth is, the science shows that all eating is emotional eating. When we eat anything, there are biological reactions in our body that affect our emotions. So the book goes all into the science of that and is also a practical guide about it.
How much of that is like differentiated, broken down between the genders or the sexes? Because I'm thinking in my head as you're talking, I don't know if I emotionally eat. I eat because my body's like, hey, you have to eat. So
right. Ladies be emotionally eating. Am I right?
Right.
Yeah.
So do we do it equally, or is there a more of a breakdown?
So there's not a lot of science. For this book, I just looked at the actual hard science, right? But I'll give you an example of how there was one study that was done that was after a hockey game, and the majority of the people at that hockey game happened to be men. And during that hockey game, after the hockey game, they gave the same sweet sour drink to all the fans, and the fans whose team had won rated it as sweeter. And the fans whose team had lost rated it as more sour and more bitter. Huh. So it's like that kind of taste perception, because all flavor happens in the brain. So anything that surrounds being a woman or being a man or being non-binary in this world, that all the things that surround that actually influence how you taste food, because all that flavor happens in the brain. It's all of our senses, not just what happens on our tongue or even in our nose. You hear a lot of that about that, like, flavor is created through scent. Yes, but that's only part of the story.
And so what is nutritional psychology?
So nutritional psychology, also called nutritional psychiatry, is a burgeoning new field that after this study that I talked about 15 years ago, the people really started looking into that food-mood connection. And nutritional psychiatry and nutritional psychology came out of that research, which is the study of how food affects our emotional well-being and even are mental health and mental health diagnoses. Now, in the book, I just get into general emotional well-being because there are such specific studies about different mental conditions. But I think that right now we're in a global crisis of mental health. I mean, I think everybody has been strained in the past 3 years, some of us to the brink. And food is a tool in the toolbox that is proven by science to work to help our emotional well-being. It's not the only tool. Don't cancel your therapy appointments. Don't cancel your medication. But it's a tool that we have that everybody uses every single day. So what nutritional psychiatry has found is that the Mediterranean diet, which is something that a lot of us are familiar with. It's food, whole grains, fruits, vegetables, fatty fish, olive oil, that kind of thing. In a limited study, brought down the incidence of depressive symptoms in clinically depressed people without the use of any other intervention. So it's these kinds of things, and we're building on that science every single day. We don't know what the mechanism is yet, but we know that it exists and we can use that right now.
Is it correct that there are certain foods you can take to help reduce inflammation, but also it causes more mental health problems?
Yeah, so inflammation anywhere in the body is just our immune system at work. Think about it, very simple. You cut your finger, it swells up, it gets warm, it gets red. That's just inflammation, right? So that happens all the time, all over our body. And a lot of it can happen in response to what we eat. It can be ultra high processed foods. It can be a lot of refined sugar. So, we know about the physical health effects of that. I think we've read a lot about that, right? But what we've learned in the past couple of decades is that there's been something called the blood-brain barrier that protects our brain, the brain cells, from any junk that's floating around in our blood, any toxins or anything like that. What we found out in the past 20 years is that those tiny little inflammatory compounds that get released into your blood anytime there's inflammation anywhere in your body, it can pass through the blood-brain barrier. It's semi-permeable. It's not impermeable. So those little tiny compounds can get through to your brain and wreak havoc with your emotional well-being. And that's just yet another reason why we should be paying attention to inflammation and anti-inflammatory foods.
And you talk about this, what you call the critical relationship between, I believe, the microbiome and the brain. Can you elaborate on that?
Oh, yeah. The gut microbiome is one of my favorite things to talk about because it's only come up in about the past 20 years that we have organisms, microorganisms, trillions of them living between our mouth and the other end of our digestive system. And they help us digest food. And they actually, because they're each their own living thing, they eat food. They process food and they produce what's called metabolites, just any byproduct of metabolizing food. And those metabolites have effect on our neurotransmitters, on our hormones that influence the way that they feel. So it's a lot of it is the same ancient. With one foot, you have the most ancient wisdom, sort of like junk in, junk out, what your mom always told you. And then in the other foot, you have the most cutting edge science that shows that this ancient wisdom is true. And that's why, a lot of us know this stuff anecdotally. We know this stuff from our insides, what we've experienced, but now we have the science to prove it and to show us which way to go.
What vitamins help to kind of restore the body during emotional times?
Well, it's an interesting question. There's a lot of study about omega-3 fatty acids, as I talked about, particularly what's called DHA and EPA. And you can see through microscopes that the neurons of brains that have enough DHA and EPA communicate more quickly than neurons that don't. And that's a lot of fish. And of course, in America, we don't eat a ton of fish. And so if you're not eating those fatty fish, DHA and EPA would be a really good supplement to take.
And real quick, you talk about a healthy eating pattern that people need to develop one for life. And I believe the book actually includes like a 30-day program. Can you very quickly tell us about that?
Yeah, the 30-day program is 4 weeks, everything. You focus on a different week. And the first one is pleasure and increasing your food pleasure. And there are really quick, simple ways that you can do that no matter what you're eating. Then inflammation, gut microbiome, and nutrients, focusing on nutrients. So it's very simple. It doesn't require a complete overhaul of your life. And it doesn't focus on weight, which I think is a really freeing message.
And Mary Beth, do you have a website?
I do. It's marybethalbright.com, but I'm also a correspondent and editor at the Washington Post where I write about these kinds of things.
Well, thank you so much for joining us on the program, Mary Beth Albright.
Thank you. Thanks for your trust.
Make sure you stay tuned. Coming up after the break, a story of recovery. World-renowned Dr. Bonati created the Bonati Spine procedures to minimize surgery scarring and recovery. 75,000 procedures have resulted in 98.75% satisfaction. Over half our patients suffer from failed surgeries at other facilities. Visit AskBonati.com. Danny is a business owner and family man currently residing in California.
Well, as far as my occupation, I am a business owner of a painting company in San Jose, California. I'm pretty active. I try to be bike riding, hiking. Where I live, there's a lot of hills and mountains as far as like my background scenery, and be with my son.
Danny first started noticing discomfort 3 years ago, but was able to continue working. Suddenly and without warning, his pain became unbearable.
My pain first started back in 2020, off and on, by picking up heavy 5-gallon buckets of paint. And I didn't pay no attention to that, and it just lingered, and it got worse throughout the weeks and months. And then fast forward to that December 10th, to be exact, of 2022, just by bending over less than 45 degrees into turning on my bathtub, my back popped, literally popped, and threw me to the floor. That's when the nightmare began. It just every single day of just pain, my lower back shooting down to my right side hip, to my feet, numbness and burning, excruciating pain, just unbelievable pain. It prevented me from be functioning in all sense of the word. Walking, being a parent, being an employer, being a person. My body was overtaken by 150% of pain with 200% of depression. I would not wish this upon anybody, because I see people living with this type of pain for years and years and decades, and I don't know how. It makes me stutter my words, because I was off and on for the better, like a year and a half, and it just totally took my life away. Standing was my way of relieving pain. If I stood a certain area without putting any type of pressure or to aggravate or to trigger my pain, it was always there. I couldn't walk as much because I'll get really tired from the sciatica and from the pain. So I caught myself maybe standing up 14, 15, 16, 17 hours a day in place. And everybody would tell me, Danny, sit down. I couldn't. It hurt me more when I was sitting, and it hurt more when I was walking any distance. I mean, I'm talking about no more than 50 yards, 60 yards, and I'm really looking for something to hold myself against.
Danny tried numerous conservative treatments to relieve his pain. Nothing helped.
Within 2 months, all the physical therapies I've taken, and I'll briefly detail about that. Physical therapy as far as the decompression machines I've done, total nightmare. Excruciating pain afterwards, and then by telling me that, oh, it's a process, you're gonna get better. No. So I did the physical therapy. I've done the most high-tech massage machines and pads, you name it, I've done it. Shots through my lower back, my buttocks, tried to relieve pain. Chiropractic done, and nothing even gave me a Band-Aid. It was just pain on top of pain on top of pain. And I did all that within a month and a half to 2 months. It made me extremely worse.
Even though he lives in a major metropolitan area, Danny found his local doctors and hospitals ineffective. Simply getting an appointment with a general practitioner proved challenging, both physically and emotionally.
So where I live at, I'm surrounded by a lot of people. I'm surrounded by a lot of hospitals and professionals, and that doesn't mean anything because the level of care is not there. I can't even get a primary doctor visit within a month or two, and I'm dealing with pain, and I'm trying to function, be a dad, and try to be a business owner.
Desperate for lasting relief, he started researching on the internet for doctors that could help.
I found Dr. Bonati on YouTube, and then I went down to doing some more research on Google, Facebook, and whatnot. And I was comparing other facilities and reputation and years, and Dr. Bonati stood out beyond, that's all I say, just beyond everybody else. You have to become your advocate. You have to. Don't settle. Do whatever you gotta do. Make phone calls, ask friends, go online. You're gonna find yourself doctor shopping at first. And you're gonna find yourself buying into these get help fix schemes, and you're gonna want to buy them. And I got sold on stuff like that. But you're gonna notice, the pain ain't going away, it's getting worse. You gotta do something about it.
After finding the Bonati Spine Institute, he sent in his MRIs for a review and quickly learned that he was a candidate for the exclusive Bonati Spine procedures.
I talked to Dr. Bonati himself the following day, called me up. And he wasn't trying to sell me anything. He told me from the beginning, yes, we can help you with this. And his sincerity was spot on.
Upon arriving at the Institute, Danny was provided a physical exam and sent for additional x-rays at the on-campus imaging center.
Then they ordered quite a bit of imaging of me standing up and laying down. They did their due diligence of looking, let's see what else is going on probably. And that right there was very insightful for me.
Danny admits that he was at first nervous upon learning about conscious IV sedation. He quickly learned the Bonati surgical staff works diligently to keep the patient comfortable and communicating with the surgeon to ensure their source of pain is eliminated.
I was scared, and that's me by nature, but to get to the point, I didn't feel anything. I did not feel anything at all. I know I was awake, but I was extremely comfortable. So when someone says, we didn't feel anything during the procedure, I can honestly say I didn't feel anything.
Prior to surgery, Danny required a cane to help him keep his balance. While in the recovery room, just minutes after his last targeted Bonati spine procedure, he was up and walking unassisted and pain-free.
That's when it was like minute per minute that I was actually feeling less pain. Only thing I did feel was the incision, and obviously you do feel a little bit where they work on you. It's just a little soreness, that's all it is. I'm getting up, walking. They want to make sure that you're walking and able to be on your 2 feet. No pressure as far as trying to get you up and go out the door like hospitals do. I feel great. I'm walking with no cane right now. I feel no need for it.
When leaving the Bonati Spine Institute, patients are not required to wear uncomfortable braces or endure agonizing physical therapy. Instead, they're instructed to walk a few minutes a day.
Walk, that's my main thing, which is walking. No hard physical stuff was asked of me to do, other than which I can walk. I love walking.
Danny is already recommending the Bonati Spine Institute to anyone suffering with neck or back pain.
Absolutely. I'm still here, and I'm already reaching out because everybody's calling me, family members and friends. How's your experience? Tell them this is the place to come. It's worth a shot. You're not wasting nobody's time. Make a phone call. Send your imagings in if you have them. If not, let them help you or try to help you. The first thing I want to do when I get back home is able to hug my son without any pain. And for him to look at me, that he's not seeing me hunched over. That's the first thing. Get off the plane, I want to see his eyes and just able to see that I got my dad back.
All right, take it easy now.
Awesome, thank you.
Awesome.
A friend of mine, she told me about Bonati. He was the only one to address all 4 discs as quickly as possible. And if you're to that point where you can't take it anymore, like I was, do your research, find out who the best is, and get it done.
Visit AskBonati.com. Welcome back to American Medicine Today. When is it that people will know it's time to seek out spine surgery?
There are different type of pathologies that they are going to require surgery.
Sure.
One is pathologies that they have an acute traumatic situation like car accidents or falls. That one immediately will give symptomatology to a patient that requires an immediate observation, x-rays, MRIs, and therapy. And sometimes that is not enough.
Okay.
So they need to seek for further treatment. At that time, usually the family physicians or chiropractors or people who's treating this patient, including orthopedic surgeons and neurosurgeons, they will decide to refer the patient for surgery. Now, that is when it's traumatic.
Yes.
The majority of the problem that we see in society today is a chronic problem. Through life, we have small traumas. For example, you step off a curb, or you have a fall that is not bad, but it's enough to give you a little twist on your back. When that happens, you're going to develop a little stress between the annulus and the attachment of the annulus to the bone. The disc has two components. The outside of the disc, like the outside of a tire, is very strong.
Okay.
And that's the annulus. And inside of the tire, you have the air. Okay, that is the inside of the disc. That is soft tissue.
Okay.
Usually that soft tissue, when you have a tear, will produce a bulging or will produce a hernia or will extrude from inside and create now direct pressure to the nerve.
Okay.
All these pathologies, they will require some sort of a treatment initially, and if they fail, they will require surgery. But when the problem is chronic, and you have somebody who has 40 years old to 80 years old, the changes start to occur inside of the canal where the spinal cord and the nerves are located. When that happens, the lower part of the spine, that is preferentially the area that we call the corda equina, where the nerves are exiting, those nerves are being now under pressure by osteophytes. And osteophytes are nothing more than abnormal bones that they are being identified by people like Spurs or things like that.
Okay.
And those ones are going to create a change in the path of the nerve. And if the change is too intense, then the nerve is going to suffer and is going to have some response that will be or pain or numbness or weakness, depending on how much pressure you have there.
Okay.
At that time, the person will be complaining of back pain, hip pain, leg pain, and then that will affect the gait of the patient and the balance of the patient.
All right.
So some of these patients are going to lose the balance and they're going to go on the floor. And when that happens, they're going to break wrists, elbows, or hips. The majority of the people has the tendency to ignore the back pain.
Yes.
Unless it's a very acute back pain, they don't pay too much attention. It's a little ache on the back and that's it. They also ignore the hip pain. They have some discomfort and they don't pay attention to it. They also ignore the knee pain. And all these are information that they are telling, the spine is telling you that your nerves are under pressure or with some problems. So you would need to have some testing of soft tissue like an MRI to be able to see if those changes there require surgery or not. Sometimes physical therapy will be enough. Some other times will require surgery.
When you talk about people falling, and this can just be in general, if they fall and they land on their knees and the wrist area, and they're in pain, how long is it something where you need to seek out surgery, or when do you know that it's that step?
there's sensations of discomfort and things like that, that you can put some type of some medication on it and some friction medication on it and gets better, and that's it. Some physical therapy will improve. There are other ones that no matter what you do, doesn't go away.
Right.
When you have a situation that whatever you do and whatever your doctor recommends, the family physician recommends medications and things like that, when you start to see that you're taking too much of some normal type of a non-addictive medication.
Right, over the counter.
Over the counter, and it's not doing that thing. And you go to a doctor and they give you now a narcotic. And if you start to use a narcotic, then you know that you're getting in trouble.
Right.
Then you need to seek somebody to give you a right answer. And usually the right answer in these cases are surgery.
And it would be surgery to release the nerves that are crimped, or to...
Well, depend what type of trauma you have.
Okay.
If you fell and you went on the floor and you broke a bone, then will require immediate surgery.
Right.
If you go and you have a fall and you break a rib, you may be saved to using a brace. And observing that is not creating a major trouble after x-rays and the physician said that you don't have any damage on the lung.
Sure.
Now, if the situation is a permanent pain, and then you start to see that you cannot walk distance that you normally walk before.
Yeah.
When you start to see now that your foot becomes numb.
Right.
Or you start to see that your foot becomes now weak.
Correct.
And your ankle doesn't support you, or you lost your balance and you cannot stand up in one foot. Or you start to see that now you need a cane or a crutches or a walker.
Right.
Then it's time to see somebody to give you the right advice to be able to correct the problem. And usually those ones will require surgery.
Well, thank you for shedding some light on that and to let people know how to kind of gauge where you're at and what the next steps would be. If you have any questions or need to know if the Bonati Spine procedures could help you, visit askbonati.com, and thank you for watching American Medicine Today. If you have any comments or questions, contact us at the number below. You can tweet at Dr. Bonati using hashtag American Medicine Today or hashtag AMT. We would like to hear from you.